The past 2 years of the COVID-19 pandemic have witnessed growing awareness and discussion of mental health in Uganda. However, difficulties in accessing mental health services still exacerbates illness severity. Upon this background, a team of researchers from Makerere University's College of Health Sciences and the Queen Mary University of London undertook a study to identify low-cost interventions to manage severe mental illness.
The study, first of all, it is an extremely important study because it used low-cost resources. And in a country like Uganda, which is a low-income country, we need resources that we can afford and can be accessed easily by patients. And therefore, that makes this study very important because it was trying to look at three types of low-cost resources and see, first of all, whether they are acceptable to the population. The population meaning the patients in particular, but also their relatives and family members.
In Dialogue Plus, clinicians at Butabika National Referral Mental Hospital clinically assessed patients with the aid of a tablet computer. Patients rated their level of satisfaction with 11 life domains including physical health, personal safety, friendships, accommodation, and medication.
So Dialogue Plus is a means of communicating effectively with the client when they come in for, their psychiatric reviews, that allows you to explore all areas that are important for an individual's well-being beyond just the medications that we give for treatment of mental illness. It was developed elsewhere in the UK, and they found that it improves the interaction between the doctor and the patient as regards their mental illness, and to allow them to be able to function well within society.
At Masaka Regional Referral Hospital, the researchers involved families in the care of patients of severe mental illness. A trilogue involving patients, family members and clinicians met once every month for 6 months to discuss mental health issues.
The essence of our study is to see whether involvement of families in the care of patients with severe mental illness improves their general outcomes. Of course, we had recognized in this country that we did not do too much regarding involvement of families in the care of patients with severe mental illness. So we set out to see whether we could do family involvement in one group and use the other one where we did not do family involvement to see if there would be differences in the outcomes. And we recruited these patients from Masaka Referral Hospital and Mityana District Hospital. Mityana was the control group, Masaka was where we did the intervention.
When people with lived experience of severe mental illness use their testimonies to educate others, the quality of life of patients is bound to improve. At the Jinja Regional Referral Hospital, these volunteers met with patients twice a month to perform different socio-economic activities, including baking, soap, candle and briquette making.
The aim of the study was to examine whether volunteers who were lay people with no mental health training would interact with individuals with severe mental illnesses, and whether this interaction would help them to improve their adherence to medications and general knowledge about mental disorders.
All three interventions registered laudable results.
Individually, in each of the study sites, we saw a lot of enthusiasm from the hospital staff, the administrators, but also the patient participants. These patients were actually encouraged and empowered to be more engaged within their societies. They were empowered to be self-reliant, We saw them learn new skills. We saw them take up income-generating activities that empowered them. We saw them become more confident in the way they expressed themselves, in the way they carried themselves in community. So we really had a very positive feedback from the 3 interventions.
With evidence that these low-cost interventions improve patients' quality of life, the researchers called for a recalibration of efforts to tackle mental ill health early.
What would it involve? First of all, training. Training of the right cadre of people to implement, like I mentioned in the beginning, and knowledge about mental health is very important. We need to take away stigma that is attached to mental health. Even when we have health workers, a good number of them still have stigma towards mental health. It is important for us to reduce on stigma within communities. The more people are trained, the less the stigma they have.
So we want to do scale up by A, task sharing, B, group therapies or group support psychotherapies, and C, mobile mental health clinics. That is now what we are doing in terms of a research project to see how best we can do that.
Communities themselves can come together and say, what can we do in our communities for our people so that mental health illness can be addressed early before it gets worse. So community initiatives are absolutely important. And with those community initiatives comes the issue of voluntarily putting in effort, contributing time to make sure that those initiatives work.
There is no health without mental health. It's time to act on mental health.
Thank you.